Hello, I'm Veronica Campbell from Integrated Manual Physical Therapy. This next video is to teach you some techniques for self-care of your sphincters. So sphincters are basically the valve or the connection point between our digestive tract. We have from the esophagus down to the stomach, we have the gastroesophageal sphincter. Then from the stomach to the duodenum, we have the pyloric sphincter. In the duodenum, we have sphincter of Oddi that connects to the common bile duct and the pancreatic ducts. And then between the duodenum and jejunal ileum, we have the DJ junction. And then from the jejunum to the large intestine or the colon or the cecum is the ileocecal valve. And so that gives you a little roadmap of the sphincters that we might need to treat. Why might we need to treat them? Well, indications can include GI upset, bowel disease, stress, anxiety, abdominal tension, all of these things, dysregulation on an autonomic nervous system because the vagus nerve innervates all of these structures. And so by treating the sphincters, you can potentially help any kind of GI symptoms as well as dysregulation and calm the nervous system a little bit. How do you know if they're dysfunctional? Well, often sphincters will feel a little firmer, harder because they can become in spasm. A functional sphincter optimally is going in the clockwise direction. If it's dysfunctional, it'll either be a little frozen, stuck, or be functioning in a counterclockwise direction. And as your hands become more sensitive, sometimes you can feel this and pick up on this. So the idea is to treat this. And this work is adapted from Jean-Pierre Barral. So I'm teaching you some of the techniques from his coursework as well as a little adaptation to make this easier for self-care. It is suggested starting with the ileocecal valve first, so from the bottom and working your way up. And the video where you see it on my abdomen, that is demonstrating the sequence in which you can do this and that I recommend as well. So hopefully this helps you with the journey. There is the diagram that I drew to give you a better idea of the anatomy, and then of course the technique so you can watch and learn to self-treat and self-care. So I hope this helps you. Thanks so much. This is for patients of integrated manual physical therapy. This diagram is to show you where your sphincters are and to give you a little bit of background on sphincters for your self-care. Please note this is adapted from Jean-Pierre Barral's work and the Barral method. Here we're looking at an image, and the idea is to open the sphincters up from the bottom to the top. So starting with your ileocecal valve, which shows number 1, then moving up to your DJ junction, which is point number 2, sphincter of Oddi, point number 3, pyloric sphincter, point number 4, and then the cardiac sphincter, also known as the gastroesophageal or lower esophageal sphincter, point number 5. Indications for this can be any kind of GI upset, anxiety, stress, GI symptoms, autonomic nervous system dysregulation, or abdominal tension. And so you can self-treat this to help improve function. The idea is that sphincters can become spasmed when they're dysfunctional. How do you know if you're on a sphincter? The description of the size is there, but they also tend to feel a little warmer and firmer. They might have a rotational quality, and if they're not functioning well, they can feel a little bit in spasm or feel a little more rigid. If they're functioning well, they should have a clockwise motion. So I'll be demonstrating this on my own abdomen so that you can see how to do the self-care, but generally you want to start from bottom to top. It's a very gentle technique, and this is just a little roadmap to help you. I'm going to be demonstrating how to treat your sphincters on yourself. So just to have a reference first, these are your pelvic bones called your ASIS. This is your umbilicus. You can feel the bottom of your rib cage, and if you slide your fingers up, there's a bony point here called the xiphoid process. So this is sort of our area that we're going to be interested in. We're going to start with the ileocecal valve and work our way up. So the ileocecal valve is typically found between the umbilicus and the ASIS. Usually about 1/3 of the way up, 2/3 of the way down, but it could vary, so it can be in variable positions. So if you follow gently compressing along that diagonal to find an area that feels a little warmer, firmer, maybe a little tender, you can start to get a sense of where that ileocecal valve is. Valves or sphincters should have a clockwise direction to be functional. And so if you're able to get a sense of that it's feeling counterclockwise, then you can work with that and treat that. If you're not sure if you feel that or not, which is quite okay, it's sometimes difficult to feel, simply by finding that spot and compress and release a few times gently can wake up the mechanoreceptors enough to kickstart that sphincter to function better. So even just some gentle compress and release, I like to call it sort of this baby CPR to wake up the mechanoreceptors, can be great. Then when we're thinking in the body, this is the clockwise direction. If it's not functioning in a clockwise direction, if it feels like it's going counterclockwise, you can swing it a little bit counterclockwise first to wind the tissue up and then swing it back clockwise. I sort of think of it like an underdog on a swing. So, or taking a swing back to push it through. So if I gently compress and I'm going to take that counterclockwise, so I twist it counterclockwise until I can't twist anymore, and then swing it back clockwise and let go. And you can do that a couple times in a row, twist it counterclockwise, swing clockwise, let go. If that's too difficult for you, you can also simply do a few, maybe 3 to 5 gentle clockwise circles on that area to help get that sphincter to function better. Then if we're moving up, we're going to go from the ileocecal valve over to DJ junction. And that's a junction between the jejunum and duodenum. So that's about 3 fingers up on the left side towards the mid-clavicular line. So I sort of put 3 fingers in a row, and then I know my target to start to look for it. Once I have that area that feels a little warmer, firmer, I start to see, does it feel clockwise or counterclockwise? If I can't tell, I wake up with some gentle compressed release to wake the mechanoreceptors up. Then I can twist it counterclockwise and spin it clockwise to kickstart it back in the right direction. You can do that a few times, as well as that gentle clockwise massage. Then we're going to move over to the right side. It's about the same distance from the umbilicus, but on the other diagonal. So 3 fingers up, 1, 2, 3, towards the mid-clavicular line. You can start to search for sphincter of Oddi. And Oddi is very important because it's the sphincter that connects to your common bile duct and pancreatic duct. So very, very critical in digestion. And so you can get onto that one, and that same thing, that gentle, wake the mechanoreceptors up, that baby CPR. It's very gentle. It should never be painful. You've done that a few times. If you can't tell if it's spinning clockwise or counterclockwise, take it counterclockwise gently and spin it clockwise and let go. You can do that a few times in a row, or simply gentle clockwise massages. Then we're going to move up to the pyloric sphincter. So the way to find that, I find the easiest, is if you can find that xiphoid process, drag your fingers down till you feel a little bump or a catch or a point there in the pyloric shelf. Within that is the pyloric sphincter. And depending on when you've eaten, it can be a little bit more to the right or a little bit closer to midline. So searching again for that warmer, harder, more dense spot. And the same techniques applied. Wake up the mechanoreceptors, spin it counterclockwise, take it back clockwise, and let go. A few times in a row, as well as the clockwise massage. And then the last one is the lower esophageal sphincter, or gastric esophageal sphincter, or cardiac sphincter. It has a couple names. That one is hidden behind the rib cage on the left, near the stomach, right? It's between the stomach and the esophagus. So if you can follow that esophagus down, follow that sternum down, find your xiphoid process and walk over a little bit. If you're over a couple fingers and up above the end of the rib cage here on that left side, you can start to search for an area that maybe you feel that clockwise, counterclockwise sensation. If you're not sure, the same idea. Compress, release, wake up with a few times the mechanoreceptors, spin it counterclockwise, swing it back clockwise. So you can repeat that a couple times in a row. And again, there's that body diagram map that I've drawn for you to help have a map for this so you have a better idea of where it is. If you're continually having problems with this, maybe search out a person that does the Barral method of visceral manipulation who can actually assess them and treat them and maybe teach you a little bit more.